Hello. It is my pleasure to be addressing the Indian Parliament on World Hepatitis Day, which is celebrated and publicized every year on July 28th. I would like to talk to you briefly about eliminating hepatitis C virus infection in India. And my thanks again to the Parliament for your time, and also to Dr. Sarin for inviting me to address you. The World Health Organization issued a policy statement a few years ago, and the objective is to eliminate hepatitis C virus as a public health threat by 2030 or before. Like COVID-19, hepatitis C virus infection is another global pandemic that kills many, many people every year. In the case of HCV, hepatitis C virus, WHO estimate that around 400,000 people die every year around the globe. And this has been happening for decades. This is not a pandemic like COVID that has suddenly fallen upon us. This has been around for many, many decades, and each year, hundreds of thousands of people die from hepatitis C. In addition, there are new infections occurring every year. Almost 2 million infections around the world every year occur. The important message that we have to give you today is that hepatitis C infection is now curable. We now have developed very powerful antiviral drugs. These are well tolerated by the patient. They are simple to take, and they cure patients within 2 to 3 months of oral therapy. So it's very simple oral administration. Patients swallow the drugs with some water, and if the patient does that for 2 to 3 months, at the end of the course, the virus has been eradicated from their bodies permanently. These drugs are very expensive in the Western world, but in India and other countries, they are available as generic drugs, and they are relatively very, very cheap to administer. In India, there are at least 10 million people currently infected with hepatitis C virus. That means at least 10 million people where the virus is replicating in the liver, causing inflammation, causing liver damage, and setting up that person for serious liver disease in the future. If left untreated, around 2 million people will develop liver cirrhosis, which is a serious liver inflammatory condition that can lead to end-stage liver disease where the liver fails and the person dies. It can also lead to liver cancer. And end-stage liver disease and liver cancer are not curable without receiving a liver transplant. And liver transplants obviously are very difficult to perform, they're very expensive, and there's a very large shortage of liver donors. The good news about this hepatitis C pandemic is that this pandemic can be stopped in its tracks by testing high-risk groups for hepatitis C infection. People that have received a blood transfusion in the past may well have been exposed to the virus, and there are other high-risk groups that we can identify. So it's not necessary to go and test everyone in India with its huge population of 1.3 billion. We start by testing high-risk groups like people that have had a blood transfusion or a medical procedure in the past. Diagnosis and tests are quite cheap now. And so before we can treat patients, we have to find which ones are positive, of course. The diagnostics are now cheap to do that. Once they're identified as positives, we can then start them on treatment for 12 weeks, at the end of which nearly 100% of treated patients will be cured for life. The current costs for testing and treating are around $250 per patient in India. There's an excellent review published just 1 or 2 months ago by Dr. Anand and Shalimar about hepatitis C viral infection in India. And because of the generic drugs that are available in India and the cheap diagnostic tools, the cost for testing and treating and eradicating the virus from a person infected is only around $250. This is highly cost effective. In addition to the huge medical benefit to millions of people, it's highly cost effective for the country to do this, and costs can probably be further reduced by even cheaper generic drugs and cheaper diagnostic tools. Like other countries around the world, India is dealing with other pandemics like COVID, HIV, and hepatitis B viral infections. These are serious viral pandemics as well, of course. But the important message today is that HCV pandemic is now curable. We have very cost-effective diagnostic testing, very cost-effective antiviral treatments available, which can, in a short period of time, before 2030, potentially eliminate hepatitis C as a major public threat in India. And so I'm leaving you with this message that elimination of hepatitis C in India is feasible and cost effective. And I urge Parliament to do everything possible to implement a test and treat strategy for your country. I reside in Canada as well as the United States, and many countries of the world are implementing this strategy to eliminate hepatitis C by 2030. Egypt has been a very good example where they have already tested more than 50 million of their citizens and treated 4 million that were found to be positive and cured 4 million patients. This is possible in India and all other countries around the world by first testing high-risk groups, people that we know might have been exposed in the past, finding who's positive and treating them with the generic drugs that are available in India and other countries of the world. Thank you very much for your attention.